There is no place for tips for as a primary prophylaxis, but in patients with acute variceal bleeding, tips is now must be considered according to guidelines, either in as a salvage tips in patients who are actively bleeding, or the novelty is as an early tips within 3 days, or ideally within 1 day in selected patients, child pug C below 14 or child pug B with active bleeding at endoscopy, whatever the type of varices. So it's now well known that we have better outcomes in these patients if we can use early tips. And the third part is as a secondary prophylaxis, meaning in patients who already bled, but who are intolerant or after failure of the standard treatment using drugs. In that case, we have to use cover tips. This is probably the best level of evidence as a secondary prophylaxis in terms of outcomes on both survival and rates of rebleeding. And fresh randomized studies have been published about the role of tips as the first-line therapy instead of drug plus endoscopic ligation, with very nice results, especially in small diameter tips, 8 millimeter in size, with better results in terms of rate of rebleeding, meaning that probably in the future we will have to do tips also as the first-line therapy. Maybe it will be the next guidelines about that. And the second topic is refractory ascites. For using tips, with many randomized studies, many meta-analyses about the role of tips in such indication, with very good results in terms of outcomes and especially on the rate of recurrence of ascites. In the only condition is to put tips as early as possible in the course of the disease. We have now a lot of randomized studies about the role of the tips in this kind of indication in terms of recurrence of ascites, in terms also of mortality, even if it's a little bit more controversial. A fresh study, a French study has been published, a randomized study, about the role of tips, of cover tips, compared to bar stents, non-covered tips, with better results in terms of recurrence of ascites, but also in terms of survival, and without any more risk of hepatic encephalopathy, which is the main risk and the main complication of tips, of course. The only thing with tips is probably the technique with the highest level of evidence in interventional radiology, but there is a recent, a fresh study from a French group reporting results. It was a French multi-center audit about real life in terms of using tips. And they demonstrated that 1/3 of patients were eligible for tips, and only 7% of patients got early tips. It means that there is a discrepancy between the guidelines and the real life, at least in France, and we have a lot of work to do to convince hepatologists and interventional radiologists that tips is very useful and very efficient in this kind of patients. And probably the next guidelines will talk about the role of tips as first-line therapy in refractory ascites, but also in bleeding patients as a secondary prophylaxis instead of the standard treatment, which is currently the use of drugs plus endoscopic ligation. And probably more indications will be to wait for in the next few months or few years about that. there is always a difference between the guidelines and the real life, but really we have to work on it, and probably, at least in France, to make some networks about the use of TIPS with hepatologists, including hepatologists, intervention radiologists, anesthesiologists, to make sure that all patients eligible for TIPS can get TIPS, whatever early or late TIPS, but at least this treatment to get better outcomes in terms of survival, in terms of rebleeding, in terms of recurrence of ascites.